Now,
maybe the casket as well.
okay, you were talking again about risk of rape and sexual violence. Why is that more of a risk during a post-emergency scenario like this?
Okay, many people are now living in tents or anyway just shelters. And in the area where displaced people are gathering now, there is no electricity, there's no light, so it is completely dark on night. And this is a huge opportunity for someone that want to violate female, etc. And another reason for this risk is that actually the camps are not organized yet. For instance, when you take the latrine, everybody is using the latrine without segregating male and female, and this is a big opportunity for someone that want to assault someone. So if you have a lady going, a young lady most likely going just on by herself without any protection, etc., and there is a big chance that she'd been assaulted. That's why generally it's very important to organize the camp, which is not the case till now in Haiti, in many camps that we have. So reproductive health is definitely an issue. It's definitely something that we should look very deeply. Uh, we should look after it, and we should look in deep and to prevent and to mitigate the risk for the women and the young girls. This is yeah, this is the issue.
Um, so what tell us a little bit about what CARE is planning to do, taking this issue into account.
Okay, one. Uh, there is just someone arriving in the country in support to the country office. This person is an expert in reproductive health and gender-based violence. And normally, along with me, just to say that once again, I'm the health program coordinator for CARE in Haiti. Along with me, we will sit and look in deep with the assessment, with quick assessment we've already done, what exactly can be the response that CARE can bring to the situation. Certainly, one of the response that we can propose and eventually implement on the field can be to see whether or not we can organize the camp, because in many camps we got committees that are already constituted, and in those committees you have pretty tough women in those committees. The idea should be to empower those women to act, to show them how to tackle this issue, and also we can provide direct support to organize the camp in a way that we can mitigate the risk for the women. I just talked about the issue of the latrine. This is something that we can look at, that we can look after this aspect, and find out a way to maybe organize the camp so that the camp can eventually find a way to segregate the latrine and have latrines for male and latrines for female. This is one way, but certainly we can come up with other aspects also. For instance, the management of sexually assault survivor, and this is a particular aspect, pretty specialized service to provide, but this is something that has to be available in almost every camp, because you can at least develop some settings for the community management, for the community follow-up of people that have been raped, and for the prevention, for the mitigate the risk for people, and all those aspects I think CARE can bring an added value for the in this context.